for the last 10 years ago, I've been developing non-invasive brain stimulation. So that's new forms of brain stimulation involving the use of small electrical currents and magnetic fields to try and improve people's thinking, and also developing these treatments as enhanced treatments for major depression and other psychiatric disorders. At the moment, these treatments are currently approved for transcranial direct current stimulation and transcranial magnetic stimulation. They're approved for a few different psychiatric indications, such as depression and pain, though their approvals are limited to those kind of disorders, and so we need to accumulate more evidence to be able to use these treatments in other psychiatric disorders, for example, anorexia, like what the Trina study is about. The Trina study, or the Trial for Enhanced Neurostimulation Anorexia trial, is a study that we're conducting at Ramsay Northside Clinic. It's investigating two different forms of non-invasive brain stimulation. One of them is called transcranial direct current stimulation, or TDCS, and the other one's called transcranial magnetic stimulation, or TMS. And the idea of the Trina trial is to compare the relative effectiveness, so to see how effective both treatments are against each other for improving some of the core symptoms that we see with people with anorexia. This is going to be one of the largest studies of its kind in people with anorexia, and we expect the outcomes will have a significant impact in the field in terms of the development of new treatments for people with anorexia. People in the study with anorexia are in hospital as inpatients. They receive their normal standard treatment as usual, and what we do is we base the brain stimulation around their usual care. So what it involves for participants is for people who are receiving the TDCS, which involves the application of a small electrical current. We teach them how to be able to give themselves the brain stimulation themselves using a headset device, and then they apply that treatment twice or once a day over the first 8 weeks while they're in the study. And then the people who receive transcranial magnetic stimulation, or TMS, that involves the application of strong focused magnetic fields to a particular region in the brain. And then with that treatment, people also receive 2 treatments a day, or 1 treatment a day over the first 4 to 8 weeks. Moving forward, we anticipate the results from this study will directly be able to inform us of which of these treatments may have the greatest potential to try and improve some of the core symptoms that we see with anorexia, such as dysfunctional or disordered thinking about food, as well as some of the other comorbid symptoms that we see. So, people often have low mood, high anxiety, and also thinking problems. So be able to tell us which kind of treatment produces the greatest effects, and then that will help to inform future research, in Australia and also around the world, for which of these two different forms of non-invasive brain stimulation has the greatest potential to be moved down the translational pathway, and then gain regulatory approval so that they can be applied safely in people with anorexia. So as a clinician, I often see and hear about the negative impacts that mental health disorders and other brain conditions have on people's thinking. So how it affects their daily life, how it affects, for example, their ability to study, their ability to interact with their friends and family and work and so forth. And I know that for most people, there's no treatment or assistance that people have with these thinking problems, and they just have to live with it. And so this is what's motivated me to help to develop new interventions and treatments to be able to try and assist people to improve their thinking and their mood.